End-stage renal disease. Definition: progressive bilateral deterioration of renal function, resulting in uremia and eventually death. Uremia is the toxic condition produced by retention of urinary constituents in the blood. Incidence and prevalence. Chronic kidney disease affects approximately 20 million persons in the United States, or 1 in 9 adults, over a 5-year period. The number of patients with kidney failure average about 90,000 annually. More than 485,000 persons in the United States are being treated for end-stage renal disease. Of these, more than 341,000 are patients receiving dialysis, and 140,000 have undergone kidney transplantation. More common in Caucasians, followed by African Americans, Hispanic, Asians, Native Americans, and then other. The etiology: infectious disease, nephritis, viral and fungal infections, hypersensitivity states, glomerulonephritis, developmental defects of the kidneys, circulatory disturbances, hypertension, hemorrhages, metabolic disease, diabetes. About 10% of new cases may result from analgesic misuse. Signs, symptoms, and clinical manifestations: mental slowness or depression, swelling and edema, muscular hyperactivity, hyperpigmentation of the skin, brownish yellow, anorexia, vomiting, diarrhea, anemia, possibly function defect in factor VIII protein, leading to hemorrhagic episodes, hypertension, congestive heart failure. Kidney transplantation: problems with graft rejection and infection. Use steroids, antibiotics, and immunosuppressives such as cyclosporine. Oral manifestations: painful oral ulcerations and stomatitis from drugs, candidiasis or herpetic lesions from immunosuppression, increased calculus deposits, anemic mucosa, oral petechiae and hemorrhage, ground glass appearance of alveolar bone caused by leaching of calcium, uremic bone disease, bad taste and halitosis from urea and saliva, enamel hypoplasia. Immunosuppressed patients who has received a transplant may have an increased risk for cancer. Drug influence, gingival enlargement from cyclosporines, an immunosuppressant, or nifedipine, a calcium channel blocker. Delayed eruption in primary teeth. Monitor for pre-medication needs with physician. Schedule appointment 24 hours after the dialysis.